Hello, hello, hello. It's so nice to meet you.
Nice to meet you too.
How has it been getting to this third year of med school? That's such a big feat. Congratulations.
Thank you. It has been a journey.
I do really wish I had known about AMBOSS before. Like, I didn't find out till like halfway through second year, like a couple months out of step. So it's kind of hard to really like shift gears so quickly, especially in med school when you're just like, you're trying to do what everybody else is doing. You're trying not to shake the boat, you know, and it was pretty new for us at the time. So how are you using it in your third year?
I'm on my surgery rotation right now. And I was waiting, we were waiting for a pathology report to come back. And so I had scrubbed out and I was like, you know, I would love to practice knot tying. And I couldn't remember how to do one of my two-handed ties. I was searching and I realized on the AMBOSS surgery clerkship guide, I actually had like the pictures of how to do the knots. So I didn't need to watch a video in the middle of the OR. I just looked at the AMBOSS picture and was able to practice knot tying in the downtime while we were waiting for pathology to report back, which I thought was incredible.
Yeah, I feel like I keep learning about new ways, you know, that AMBOSS is like just like being innovative and creating like new tools for us to use. I think with the way that even that I used it in clerkship and the way that I'm using it now as an intern is definitely using the Knowledge app as my Google. Like if I'm seeing a patient and they have something that I haven't seen in a long time, I'll just pull it up and it'll tell me clinical presentation, the etiology, the epidemiology, treatments, complications, like everything all in one. But the fact that they have clerkship guides too, especially like, I think depending on where you go, my clerkships were 4 weeks long, which is real short. And so to have to get through all of the material and be ready for the shelf at the end of those 4 weeks, having a clerkship guide would have set me up for success. Coming into med school, it is like resource overload, it's knowledge, information overload. How was your life like in terms of studying before you found out about AMBOSS and then after?
Medical school, the best way to describe it is resource overload. You know, you have so much that you need to learn in so little time. And when you have like 100 options, it seems like, how do you choose? I feel like I was a little bit more disorganized before AMBOSS. But what I like about AMBOSS is that you kind of have everything all rolled into one. Like you don't have to search. You don't need to have 20 tabs open, you know. I mean, it's fine if you want to constantly scroll or, you know, worry that your computer is going to get bogged down from having all of these different things open. But, you know, AMBOSS is kind of that one-stop shop, which is really nice. And I think the importance of doing questions early, getting into that question mindset, you know, that strategy, you know, you have to learn how to be a good thinker to be a good doctor.
Yeah.
I think you can't emphasize that enough. And I think like if it weren't for AMBOSS, I wouldn't have started doing questions so early, and I probably wouldn't have done what I have so far in medical school. And I think that's really important.
So going from like disorganized to a little bit more efficient, I think that's A1 and very important and very needed. You know, in like our world of constantly studying for the next exam. There's always an exam, there's always another board exam. Like how do we best use our time and our resources?
I actually used AMBOSS for all of my first year courses.
Oh, wow. Tell us about it. How did you incorporate that into your study game?
I'm definitely a visual learner. So I do, you know, whatever video learning, whatever I got from lecture. And then I really wanted to test, like, do I understand these concepts? Can I apply it? And so I would actually try to do all the AMBOSS questions for whatever block I was in. So like in my neurology block, I did all the neuroscience questions. For cardiology, I tried to do all of the cardiology questions. There are a lot of questions, so there were definitely some times where I didn't quite make it through all of them, but I really think that doing all those questions really, like, one, helped me target my studying. You know, you have to be as efficient as possible. So it makes sense to study, you know, spend a little bit more time where you need more help. So I thought that was really helpful.
It has been such a pleasure to sit here and to talk with you and to get to know about you and your journey. Is there any like last minute things that you want to say or words of encouragement to those that are watching?
Your journey is going to be your journey. It's easier said than done, but try not to compare yourself to anyone else. You know, your journey is what you need to do, and you're going to get through regardless of what you do. You know, you don't have to have the same path. You don't need to use the same resources. You know, just do what you need to do and it will get better. I think early on in the medical training. I was a little bit nervous, but it does get better every year. And I'm sure you can speak about that now that you're in residency.
Yeah, it has been a journey for sure, but I think being able to be with my patients and see like the impact that I have on them has definitely been something that keeps me coming back. So it definitely gets better. It's a lot more hours, but it gets better. But yeah, thank you so much, for sharing everything that you have shared. I hope folks can understand like how AMBOSS has been like super helpful for you to be able to use all throughout, your journey. And like the fact that I'm still using it now as an intern is, I think, really speaks to like the longevity of the platform and all of the ways that we can use it. So thank you so much for sharing. And it's been such a pleasure talking to you and getting to know you.
Thank you so much. It was so nice to talk with you.